everyone, and welcome to another episode of Unzipped with Sherry with yours truly. Obviously, I am Sherry. You know the old saying, an apple a day keeps the doctor away? Well, for today, we're throwing all the apples out the window because we got a doc in the house today, and we're so excited, and we're welcoming the doctor in the house today. On today's episode, I'm really excited that we have Dr. Mark Paya, who is a bariatric surgeon out of West Hills, California. He is the founder of Surgithin, which is the California Surgical Weight Loss Center. And I'm really excited because I get asked a lot of these questions on a daily basis, and I never want to give out the wrong information. And normally on the show, we do a disclaimer that I'm not a medical professional. I cannot give out medical advice. But today we have somebody who can. And so, Dr. Paya, I hope you're ready because we are about to get unzipped. With Sherry is a bariatric podcast talking about weight loss surgery. I am not a licensed professional. Any views and or opinions expressed in the show are those of the speakers and do not reflect the bariatric community as a whole. Always reach out to a professional with any medical issues you are experiencing. Thanks so much for We all have a story on how we got here, right? So for me, I used to be over 350 pounds until one day I made the single decision that I wanted change. Weight loss surgery has saved my life, and now I am here for you. I want to hear your story.
You know, the one that happened during that before and after picture? It's time to unzip. What's your story?
Hello and good afternoon, Doc. How are you doing today?
Hi, Sherry. I'm doing great. Thank you for having me on your show today. Very excited.
Me too. And first and foremost, I just want to say thank you so much for taking the time to come on my little show today and answering questions. I'm sure that you get asked a lot of these questions all the time. So I have a feeling it's like pulling the string and the answers are just going to come right out for you. But I'm looking forward to delving right into it. But before we start answering all the questions, I thought maybe you can just take a moment and kind of tell us a little bit about your background and how you got into this.
Sure. As you know, my name is Mark Paya. I do bariatric surgery, and I did my surgical residency at UC Irvine, which is about 60 miles away where I practice right now. And I did a general surgery residency, and then I did a fellowship in bariatric surgery, which is weight loss surgery. And then after that, I came to West Hills, where I grew up. I did most of my schooling, elementary, junior high, high school here at West Hills. And I started practicing, a private practice with the hospital, which is West Hills Hospital, which is right next to me. And the reason, I became interested in weight loss surgery because I found it to be very gratifying. My patients, a lot of them were morbidly obese. They were, 300, 400, 500 pounds. And after we did these surgeries for them and they lost so much weight, they could do all the stuff they wanted to afterwards, even going to a restaurant, roller coaster, theaters, which they never did when they were morbidly obese. And it was very gratifying. It was something I really liked doing, and I enjoyed, and I liked the surgery and the outcomes.
I absolutely love that. And if I understood this correctly, I might have done a little Google searching on you last night. Is it true that you've performed over 5,000 bariatric surgeries?
Yes. We have a very busy practice here in West Hills. I started here in 2004, and I've been here since then. So about 17 years now. So in those 17 years, you get to do a lot of surgeries.
I think that's absolutely. And one thing that's crazy is I discovered you on TikTok. Well, like most people, you have like a really big following on TikTok. But I was like, this guy is from my hometown. I'm from West Hills, California. So it was so crazy. I was like, had I known that, I could have been like having my surgery in your office. But obviously everything happens for a reason. So I kind of
That's right.
want to just like delve right into it because I got a lot of questions in ahead of time, which are very like I hear these questions all the time. I don't always know how to answer them. So I think after 5,000 surgeries, I think you might know a thing or two about, gastric surgeries. Um, so one question that we get asked often for people who are thinking about having the surgery is what's the difference between the gastric bypass, the gastric sleeve, or the balloon? And how does somebody know which option is going to be best for them who are thinking about it?
That's a great question. Usually, gastric bypass is the older surgery. Actually, it was invented by Edward Mason in Iowa in 1967, and it's improved over the years. And we still do a lot of gastric bypass. Gastric bypass is not only a restrictive operation, that means it limits how much you can eat at a given time. It also has a malabsorptive component to it. That means
Mm-hmm.
what you eat, you won't absorb everything. You absorb about 70%, 30% you don't. And that leads to more weight loss compared to other surgeries. For example, gastric bypass, I would do on a patient who is morbidly obese, like anyone, 300, 350, 400, 500 pounds, who has diabetes, because gastric bypass does very good with diabetes and it
Interesting.
resolves it completely. And I've seen diabetes resolve even after 1 week of getting gastric bypass. So it's not just the weight loss that resolves the diabetes, but it's the metabolic hormone fixation of gastric bypass that resolves diabetes. So it's very good for morbidly obese or super obese with diabetes. The second one, which is laparoscopic sleeve, which is the most common operation for weight loss right now, I would say 80 to 90% of all the weight loss procedures that I do is sleeve. And when sleeve came around 2007, 2008, it took over lap band and a lot of gastric bypass that we
Mm-hmm.
used to do. So sleeve is I would say is the gold standard right now of weight loss surgery. Sleeve, basically, it's a purely restrictive operation. It doesn't have any malabsorptive. So we do laparoscopic, couple holes on the abdomen. We go in with tiny instruments while I'm looking at the monitor. And we reduce, for example, a 20 or a 30-year-old stomach into a 4-year-old stomach. We take 80% of the stomach out. And the stomach ends up looking like a banana, and same size as a banana. Couple of things happens when we do sleeve. The appetite goes down dramatically.
Mm-hmm.
Small portions fills up the patient, and patients lose weight, and they lose anywhere from 70% to 100% of their excess body weight in the first year. It's very consistent, very effective, very safe.
Yeah.
Okay.
And if I remember correct, I think I learned a while back that the sleeve used to be part one of a two-step process to doing the
Yeah.
bypass, but then they noticed that the sleeve patients were getting really good results just in it of itself, that they didn't have to
Um,
resort to the second half of it. Is that true? I think he might have. Are you there? So hopefully he's going to come right back. Looks like that his camera has frozen a little bit. Hoping that he's going to confirm that, because that was one of the things that we had learned in the deep dive episode, was that the gastric sleeve was part one of a two-step process into having the gastric bypass, and that they noticed that when people were having the sleeve done, they were having all of the weight loss coming off, that they almost didn't need to do the bypass. And then for some people, even today, and hopefully he'll be able to come back so that he can confirm this, is people who have the sleeve, if for any reason that they don't get to lose all of the excess weight or a good portion of it and are still struggling afterwards, there's still the option of having what they now refer to as a revision. And in the revision is when they can go to the second part and actually do the full bypass. Looks like that he has signed off. I have a feeling that he's going to be trying to come back on right now. But while we're waiting for him, if anybody has any specific questions that they want to ask the doctor when he comes back on, let me know. I do have a bunch of questions I know that one of the biggest ones is the issue with straws. I feel like it's a very taboo subject. If you go on social media and you mention the word straw, you have people on either side of the spectrum that are for or against, and they're not a big fan of it. So I'm really curious to know what his thoughts are when he comes back. Hopefully, he's going to be coming back soon because I don't know the answers to a lot of these questions. So I was hoping that he was going to be able to answer them. So yeah, so those of you who are watching at home right now, if there's any questions that you want to ask, if there's any issues that you have have always been curious about, if you're thinking about having the surgery, type in your comments now as you're watching it, and we'll make sure that we get as many of them answered as soon as he gets back. But what was interesting, I'll just tell a quick little backstory since we are waiting for him. I think he's back. Let's try this again.
Okay. Can you hear me?
You are back, good sir. Welcome back. Nothing like live technical difficulties to liven up a Wednesday. So we are good to go.
Sure, sure.
Um, so that was one of the things that
You were saying as a two-part operation.
yes.
We used to do the sleeve. Yeah. Sleeve was actually part of a BPD, biliary pancreatic diversion. And what we used to do is for super obese, we used to do sleeve, wait 2 years, and either do BPD or do gastric bypass, one of those two. But what we found is that when we did the part one, which was the sleeve, these patients did so well that they didn't need part two. That's why sleeve became its own entity. And now we do laparoscopic sleeve as operation.
Right. And one of the things that I want to ask you about too, because we started talking about it when you were coming back, is that why so now that people have the sleeve, have the option later on down the road of having a revision and actually getting the bypass. And I'm just curious, based on your practice, how often does it happen where somebody has the sleeve and ends up resorting to the full bypass down the road?
It happened. I would say less than 10% of patients who get the sleeve could end up getting the gastric bypass. And those patients are usually heavier patients. For example, 350 plus. But anybody with lower than 300 pounds, they get the sleeve. They usually stay with the sleeve and they do very well.
Okay. And then what would make somebody a candidate to do the revision down the road?
I mean, if, for example, there could be a couple of different examples, but if somebody, let's say, was 400 pounds when we started and they lost 150 pounds and they're at 250 and they still want to lose more weight, you can always go from sleeve to gastric bypass.
Okay.
Or you can also go sleeve to tightening of the sleeve. That means that's a revision too, but absolutely. So what we do, we actually put a camera in, look if the sleeve has dilated or has gotten enlarged. So what we do, we actually take them back to the surgery and tighten the sleeve down like it becomes its original size. And they lose weight that way too.
Interesting. So one thing that I've heard, and I was curious if this was true or not, is it true that there are different gauges or different size sleeves that so some people might not have the same size sleeve procedure?
It's true. I use a 36 French bougie. A bougie is a plastic rod that we insert through the mouth into the stomach, and we carve the sleeve around that. So all my patients get that size sleeve. But for example, if there's a surgeon who does it 40 or a 42 bougie, their stomach is going to be a little bigger than the stomach that I make. Okay. 36, I found out, is actually very good. The patients tolerate small portions. Weight loss is extremely good. And they do well, because I used to use 40 bougie, and I've noticed since I've been using 36, the weight loss is better.
Interesting. So do you think it's more like a matter of preference for each doctor, like the size that they decide? Okay.
They're comfortable with that size and that's how they use it.
Okay.
That's what they use. Yes.
Okay. So then this will lead into one of the most asked questions that people are asked all the time is, can I stretch my sleeve? Can I stretch my pouch?
I mean, it's possible if somebody continuously overeats, okay, every day. It's possible after a year or two you can actually stretch a sleeve and you can
Mm,
accommodate more food, and then there can be some regain of weight. And that patient, usually they come to me and they say, doc, I can eat more, my weight's going up.
mhm.
And that by itself is, she or he is a great candidate to go for laparoscopic revision, which is sleeve tightening again.
Okay.
So it is possible, but if once you get the sleep and when you eat, you're full, you should stop, get up from the table, go do something else, and try not to continuously overeat and you can stretch your sleep. It is true, you can do it.
Okay, but can you stretch it to like the size that it used to be, or is it because like something that I found that was interesting for me personally is I'm 8 years post-op, and there was a time years ago where I had had about 50 pounds of regain, and I noticed that I could eat more, and I'm like, I stretched my pouch, I stretched everything, I'm a failure, and I could to this day I could eat like an entire bag of chips and still be hungry 10, 15 minutes later. But I noticed that if I went and just had a solid chicken breast, even all these years, 3 or 4 bites, and I'm starting to get full already. So then I'm like, did I really stretch it out as much as I thought I did? Or is it more, it's just the foods that you're eating that you can tolerate more quantities of?
Yeah, I definitely think the latter, what you said. You could never, just to answer your prior question, you could never
Mm,
stretch it to its original size. Never.
okay.
I've never seen it. It's impossible because we take 80% out. Okay. You could stretch it a little bit. Okay. And, but it's also what you eat. For example, you mentioned bag of chips. Okay.
Hmm.
Chips in general, you digest it by your mouth. That means you break it down and you can eat a lot of it because once it goes down, it's almost like powder. Okay,
Right.
but breast chicken or meat or turkey or fish, they go down as a bolus, so you get filler. You get a more full feeling um, sooner than like eating a whole bag of chips.
Okay. That makes a lot of sense. So I have a question, and I feel like it's going to piss a lot of people off, possibly, because on social media, it's almost like this debate. Um, Straws. People will say you can never use a straw again for the rest of your life. Other people are promoting, hey, I use a straw and everything's fine. I'm curious to know your opinion on the use of straws with people post op.
Usually straws, we tell our patients not to use a straw the first 2 months after
Okay.
surgery. And the reason is when you use a straw, you actually push in a lot of air with it too.
Okay.
So we don't want to put too much pressure on the staple line, especially at the beginning, because we want everything to heal up. But afterwards, drinking with a straw, I don't see anything wrong with it. And most people, when you drink liquids, you're not going to get filled up because liquid doesn't stay in the stomach long enough. It passes through.
Right.
So you're not going to get filled up on liquids. So I don't see anything wrong with using a straw, but try
Eh,
to use paper straw. Yeah.
a paper
Or,
straw and stuff. Yeah,
yeah.
because it's funny. Even all these years later, I've noticed sometimes I'll use a straw, and like you said, you swallow some air, and it kind of creates like this uncomfortable feeling. And then there's other times where I have no reaction whatsoever, so it's kind of hit or miss.
Right.
Um, but it's kind of nice to know that it's okay to have for people. One of the other most common questions is, what is your opinion on carbonation post op? Now, I know most all programs will say the first 2 to 3 months, no carbonation, no alcohol, no caffeine or anything. But people who are long term or further out, what is your opinion on carbonation? Does it stretch the stomach out a little bit?
You see, carbonation, there were two articles in 1986 in New England Journal of Medicine that came out, and that was for gastric bypass patients. And
Okay.
they they proved that carbonation, especially early on, can stretch the gastric pouch. Okay. With sleeve, we really don't know. But again, I recommend to be on the safe side is that
Mhm.
the first 3 months I would not recommend any carbonation. And in the if you want to have carbonation, I tell my patients sometimes take a bread and just steer it inside, because it takes some
Mhm.
of the carbonation away, so you don't have too much carbonation inside your small stomach.
Okay.
But yeah, but the first 3 months I don't recommend having any like Perrier or any carbonated food, I mean drinks. But
Which
after that you can.
yeah, and I'm assuming like anything else, you're gonna know your body better than anyone. Like if it doesn't sit well with you, don't drink it. I mean,
Absolutely. Absolutely. Yeah. Just got
I
to
mean,
use some common sense.
yeah, and I know like for me, they had told me no carbonation for the first 3 months, and I was so worried about having any kind of complication because I'd never had surgery before that I almost went overboard. I think it was almost a year before I even had a sip of a soda because I'm like, I don't want anything to happen. And even to this day, I think once you've gone so long without it, the craving's gone. Like it's out of
You
my
don't even want it
system.
anymore.
I don't even want it. But once in a blue moon, Dr. Pepper used to be my jam, back in the day. So I will have like a
Yeah.
sip or two. But again, just like with the straws, some days it will sit very heavy on me or it'll make me uncomfortable. And other days it's not as bad. So for me, I just try to avoid it entirely. I don't need it. And I've learned to enjoy water as much as I can get in. Um,
That's the best way of doing it. Yeah. Try
yeah.
to avoid it as much. If you want to have it once in a while, it's fine.
All right. Well, the doctor said so, so it's okay once in a blue moon. Um, I love this. So, one question that I'm very curious about, and I've seen people because people who are preparing for surgery, half the doctors out there are putting them on this liver shrinking diet, this 2 week pre-op diet. There's other doctors out there like mine who didn't have a pre-op diet. For me, it was literally just clear liquids the day before. So two-part question is I'm curious why is it so kind of split down the middle? And two, what is it that you guys use in your practice?
I mean, this is a very good question. In the past, we used to be very diligent about having a patient on a 2 week or a 1 week liquid diet before surgery, or sometimes even longer. Um, and the reason behind that is that if you go on a liquid diet for a while before surgery, you can actually shrink the liver size. And the liver is right on top of the stomach. So what we do nowadays, because we have great retraction systems
Mhm.
now, that we easily lift up the liver and do the surgery. Okay.
Okay.
So in the past, we didn't have, very good retraction systems. Now we do. So it doesn't really affect us as surgeons. Even if the patient has a big liver, we can still do the operation. Okay.
Okay.
But for patients with a high BMI, for example, BMI 50 and over, if they go on a 2 week liquid diet, it does shrink the liver a little bit, makes it easier for the surgeon to operate because they can lift that liver up and they can see and visualize the stomach better.
Okay.
Okay. But for us, we go anywhere from 2 to 5 days, and our nutritionist actually recommends that when they see the patient, and it really depends on their BMI. If their BMI is high, so we give them longer days of liquid diet before surgery. If
Oh,
their
okay.
BMI is not too high, we don't. Maybe a day or 2 days of liquid diet before surgery.
Interesting. So for you guys kind of factor in one, which procedure they're having, and then two, what their BMI is and how much they have to lose, and then you gauge it around them specifically.
Yes, yes,
Okay.
it's selective.
Okay, interesting. And then so one of the questions that people ask a lot too is especially the ones who I I didn't have to do a 2 week pre-op diet. And looking back, I feel very grateful for that because I'm watching what people are going through and they're struggling because their full stomach is still there. The hormone is still there. They're
Mm.
doing and I feel like the mental struggle is far harder for people who are doing this pre-op diet. And then all of a sudden they'll find themselves in the middle of the 2 weeks and they ate something they shouldn't have. And they're like, oh my God, I'm not going to be able to have surgery because I cheated on the pre-op diet. Um, so what happens if somebody does not follow the pre-op diet to a T?
Really, nothing bad's going to happen. Okay.
Okay.
as long as you stay, if your doctor really recommended you to have 2 week liquid diet, try your best to do it. Okay. The most important is that day before surgery and being NPO, which is nothing by mouth, eight
Okay.
hours before surgery. That's even more important because we don't want you to aspirate, when you go under general. So those are the main issues. And but if you have a little snack or something, other than liquid diet during the 2 week period, it's not the end of the world. You could still get the procedure.
Okay, that's good. I feel like there's a lot of bariatric people who, once they've gotten to a certain point post-op, they kind of become know-it-alls, and they're like, "You need to do this, and you failed, and you're not going to be successful." And you're like, "Whoa,
Right.
seems a little harsh." So one thing that I was really impressed by, when I told you I did like a little Google search on you, some recon. One thing that I was really impressed by was that not only do you perform the surgeries, but you work with other resources, and you work with nutritionists and psychologists and fitness trainers and people and other people in the health profession to really help with like the long-term success of your patients. And I was really blown away by that because 8 years ago, my doctor was phenomenal and I absolutely love him. But at the end of the surgery, you're kind of thrown out like a lamb to the wool, like you have to figure everything out on your own. Like, I didn't know, in the first 2 months, I had a specific program, liquids, puree. And
Right.
then after that, it's just introduce food slowly and follow a normal diet. And you're like, I don't know what that means. Like, how much protein 8 years out am I supposed to consume? How much water are you? And so I love that you have a more proactive role. You don't just perform the surgery and then send them on their way. You
Right.
genuinely are invested in their long term success. And so I was hoping that maybe you can talk a little
Sure.
bit about what your process is with your
Sure.
patients.
I mean, studies have shown, the more comprehensive your practice is, the better your patients will do. So in our practice, the way we do it, we have a psychologist that sees the patients before surgery. The reason we have a psychological evaluation, we just want to make sure mentally and
Hmm.
emotionally the patient is ready for lifestyle change. Okay. And then they also meet with a nutritionist. The nutritionist talks about what you eat before and what you eat after. And they follow the patients also. And then they meet me, which I do the procedure for them.
Right.
And we see everybody 1 week after surgery, 1 month, 3 months, 6 months, 9 months, 12 months, and then yearly after that. So we always keep the patient in our practice, and they become part of our family, and we know them, we know what they do. And that's how good practices get really great outcomes.
I absolutely love that. And I wish like I said, I wish I knew you back then. You were literally in my backyard too. Like I could have just like stepped right in and be like, hey, I need some help right now. Um, So one of the biggest fears of people is having regain. And like a lot of us have been there before where things happen and then, a couple pounds come on. And then especially we learned during the pandemic, there was a lot of new freshman 15s and people like putting on some weight. Do you have any advice for people? Like, are there any like certain like warning signs or like certain triggers that kind of start the element of the regain process? Or is there a way to help prevent that from other people?
I mean, I want to reassure people that if you regain weight and it's really you just got to get back on the saddle again. If you had a bad weekend or if you ate a lot during a weekend, just Monday is a new day and you start eating healthy, working out, and start the whole process again. For example, if some patients hit a plateau or they regain weight, they can always go on a 3 or 5 day liquid diet, and it shocks the system, and they start losing again.
Mhm.
Or they can have protein shakes, beef broth, chicken broth for those 3 days, and then they start losing again. So I mean, these are the advices that I have, and I just don't want people to get discouraged if they've had like a bad week or two
Right.
weeks. They can always get back into it.
Okay. And then for people like once you, is there like a certain like time frame for people that's like once you've hit like let's say the 18-month mark or the 3-year mark, then if you've had success until that point, then you're pretty much good. Is there like any kind of a gauge like as long as you've gotten to X point, then it's kind of clear cut after that?
I mean, it's true. I mean, most patients who do very well 12 months after surgery, that means they've lost 80 to 100% of their excess body weight and they've reached their goal. Those patients do very well years to come. And this is what I tell my patients mostly. The first year, be as strict, as diligent with yourself after the surgery, and the years to follow to maintain gets a lot easier because
Okay.
you know what to do, you know your body, then you know how it responds to you, and that's what we tell them, and that's why we keep a very close eye on them the first year. We see them, 3 months, 6 months, 12, 9 months. So we want to make sure they do well during that first year.
Yeah, and Jason wrote in and said it takes 5 years to get us to a single digit percent chance of regain, and I think that's fair. I think if you get to the 5-year mark, you pretty much know what you're doing at that point, and like if you haven't had regain, then you're less likely for sure to have that. Somebody asked a really good question: when does losing too much weight become a problem?
Well, we all have ideal body weights, depending on our frame size. Usually we have either large frame, and usually our BMI to be normal is anywhere from 20 to 25. Okay. If you go below 20, that could be, you've lost too much weight. But that rarely ever happens with sleeve patients. Actually, I don't remember seeing anyone lose too much weight with sleeve or below. But I have seen it with gastric bypass. Not a lot, but I
Okay.
would say less than 5%. They can go overboard and lose too much weight. And if that happens, there's remedy for it. You just basically have to up your calories.
Right.
You got to start eating more carbs. You got to start eating like bread, pasta, or things that have a higher calories, and then you can come back up to your normal BMI.
Right.
Yeah.
Now, hypothetically, somebody comes into your office tomorrow and they go, Dr. Paya, I had my surgery 2 weeks ago. I have been stalled for 3 days. I think my pouch is broken. My friend didn't have a stall for the first 6 months. What is wrong with me? What can we tell them who are freaking out? Because everybody stalls differently, as I'm sure you can explain to us.
Yeah,
But
sure.
what can cause somebody to have stalls at different points in their journey?
Well, 2 weeks is a little too early. I mean, we're not going to lose weight overnight, okay? Because we didn't gain the weight overnight either. It
Right.
took years to gain the weight, so we're not going to lose that fast. But we're all going to hit plateaus. We're all going to hit stalls, and we don't lose weight linearly. We lose weight, we hit a stall. It's like a staircase effect.
Mm,
And sometimes these stalls could be longer than your friends' stalls. Okay.
right.
And you gotta shock the system. This is what I tell them. Usually, if they're working out, if they're exercising, you got to change up your exercise. Or if they're not exercising, they should start exercising. And the other is their diet. As I told you before, go on a 3 or 5 day liquid diet. That kind of shocks the system, and they start losing weight again. And those are the ideas and the reassurances that we give our patients, that plateaus happen. It happens to everybody. Our bodies, human bodies, we want to hold on to the weight. you know
Right.
they want to and the only way we can let go of this weight is to kind of shock it a little bit, to change it from the ordinary lifestyle that you have, either with liquid diet or exercise. Those are the only two things we can do.
It's very true. And then so excuse me. I have so many questions. And I have a page and a half of
Sure.
notes for questions. One question that's asked very, very often is hair loss. Why it happens, and why is it people like me who had naturally thin hair to begin with are the ones who lose the most and have like the patches of baldness? And so, question one is why does it happen? And question two, for those who are really worried about it, is there any remedies they can do to kind of help the process when they're in the middle of it?
Sure. Yeah, hair loss is actually common with weight loss. Either you had surgery or if you don't, it can happen with weight loss. And if you had surgery, usually hair loss happens between 3 months and 8 months after the procedure. And the reason it happens, that means you're not taking enough protein. Okay.
Okay.
Our bodies, the human body requires 1 gram per kilogram per day of protein. That means a 70-kilogram man needs, or woman needs, 70 grams of protein. And when you're losing weight, you might need a little more than that. Okay. So if you don't keep up with the protein, then the body goes after the hair follicles. That's the first thing that happens. And that's how you get weight loss. I mean, hair loss. But hair loss is completely, it comes right back. Okay, your hair is going to come back usually after 8 months. But if you keep up with the protein intake,
Mm-hmm.
you might not get any hair loss at all.
Interesting. So protein can definitely help. Now, I don't know if this is a theory or not. I have been told that sometimes if people are put through a traumatic situation and your body goes into that fight or flight mode, usually what might happen months later is that your hair follicles will freeze as like a defense mechanism. And then once it realizes that the threat is no longer there, then it kind of gives the body permission. It's stabilizing again, that the hair follicles will like unfreeze. I've known people firsthand who've had traumatic experiences, not even weight loss related, just in general. And then 6 months later, they start losing their hair. And I've been one of those people that I've had that happen to me before, whether it's like a stressful job or something bad happens. Is there truth to that, or is that more like a myth?
I mean, that can happen, but scientifically, I don't have an answer for that.
Okay, that's fair.
Yeah, we don't know if there's any science behind that, or if that can happen because of the flight or flight reaction.
Okay.
But I can
Um,
tell you, after weight loss, you can lose your hair, but it's replaced. It comes back.
Yeah, and I can tell people I'm living proof it does come back. And like I said, my hair is very thin to begin with. But we also got a question in by Firefly's Journey, who wants to know about alcohol consumption and when is it okay to have alcohol?
Alcohol. Well, again, alcohol is a lot of empty calories. We should all know
Right.
that, and we actually gain weight with alcohol. Um, Alcohol is okay as long as it's in moderation. You could start, drinking. Usually, I recommend, 3 months after the procedure. Okay, but know that after sleep and after gastric bypass, you can get drunk with lower volume of
Hmm.
alcohol. You have to realize that, especially if you're, definitely don't drive if you drink, for everybody. But if you have sleeve or gastric, especially gastric bypass, you can get drunk with even like half a cup of wine, because it goes into your system faster.
Okay. Oh, we have a really great question that just came in from Cindy. She asked, if someone starts taking estrogen or testosterone after their surgery, what is the impact on their weight? Is the answer different for cis and trans patients because the dosing may be different?
Um, no, I don't believe that there's any effect on weight loss. But I do know, like, if you're on hormone replacement therapy, for example, estrogen or testosterone, I recommend them not to take it 2 weeks before and 4 weeks after surgery, and then
Okay.
retake it, because thrombosis or blood clots increase with these hormones. So plus general anesthesia. So 2 weeks before and 4 weeks after, don't take it, and then you could resume that after the 4 weeks.
Okay. Oh my God, you guys are like amazing with the questions today. I almost don't need my page and a half by myself. What's the recommended time frame for getting pregnant after weight loss surgery?
1 year.
Okay.
So yeah, recommendation is after you get the procedure, try not to get pregnant during that first year, because you're trying to lose weight, and pregnancy might not allow that to happen. So after 12 months, it's safe, and you're going to have a safer pregnancy because your
Yeah.
weight is down, and the risk factor, you're not going to be a high risk pregnancy, and
Right.
it's going to be better for you.
And is the recommendation different from somebody who has the sleeve versus the bypass, or it's pretty much the same?
Same,
Okay.
same. 12 months.
There you go. Did you hear that? Go out and get knocked up. You have permission, as long as it's been a year out. Um, so for like, I know that I've talked about this on the show before. Is I'm 8 years post op, and I've been working with trainers over the years, like trying to tone and stuff like that. And there's certain trainers that I'd come across that I don't use anymore, but they are not in tune with the bariatric side of surgery. So they base it off of an average person as far as how much protein to consume. And they say that I need to consume 1 gram of protein for every pound that I weigh. And I'm like, I weigh 170 and I can't physically consume 170 grams of protein
That's,
every day. And
that's a
they're
lot.
like, well, don't worry, we'll get you there. And I'm like, I don't know if I can physically handle that. So for people who are more than like a year out, or maybe even over 5 years post-op, is there like a general guideline that you think that we should be adhering to, like on an average, on how much protein and water and nutrients we should be getting in every day?
Yeah, 1 gram per pound is a high number, but recommendation is 1 gram per kilogram. What does that mean? That means
Oh.
1 gram per 2.2 pounds.
Oh,
Okay.
see, that makes more sense.
Yeah. But for example, look, if you're a bodybuilder, you might need that 1 gram per pound because you
Yeah.
want to build the muscle. Okay. But at the same time, just be careful because protein can put a toll on your kidneys. So if you're taking a lot of protein, you got to dilute that a lot. That means a lot of water during the day.
Okay.
You don't want that. You don't want your kidneys to take a hit because of the excess protein.
Interesting. No, that makes a lot more sense. So I can tell those trainers to go smurf themselves because the doctor gave me better advice. Um, oh, here, that's actually a question I wouldn't have thought of. Is there an age limit as to an age that you would not recommend surgery for?
Um, you mean by low or high or either or?
I guess that's a good question. Maybe either or. Is there like an age, like if they're under the age of whatever?
Yeah, I mean, if they're under the age of 18, or let's say 16, usually I ask them to get a bone x-ray to see if their growth has stopped or not.
Oh,
Usually
good.
it's an x-ray of the hand, and you can tell if the epiphyseal plates are closed or not, and that will tell us if the growth has completed or not. And
Hmm.
if it hasn't completed, I don't recommend weight loss surgery at that time. I would wait till they're older. Um,
Right.
for anybody with a age of 70 or higher, it's very selective. I mean, I know some 70-year-olds that are so healthy they're like 50 years old. Okay, so I usually take that patient by patient.
Okay. I mean, and that's fair. Um, One of the other questions that I get asked personally a lot is people are always asking me like how many calories I'm consuming in a day, or how many calories should they be consuming in a day. And I'm like, I don't know the answer to that because we all have different tolerance, levels. Like for instance, some people can drink a gallon of water every day. I will physically keel over when I hit the 70-ounce mark. I will physically die and keel over. So I can't, but other people are different. So is there so for people who are more than a year out, is there like a rule of thumb as to like a calorie range, or is it more about, people talk about macros? I don't really understand macros, but is there like a guideline or a gauge that we should be
Right.
following?
Um, my recommendation is 1,000 calories a day. Okay, and that's basically with breakfast and lunch and dinner. Um, if you're more than 1 to 2 years out of surgery, you can go up to like 1,200 or fifteen
Okay.
hundred. It's fine, but anything more than that, you can gain weight. Okay, but
Okay.
anything below the 1,500 is definitely fine. But during the first year, 1,000 calories a day.
Okay.
Okay, because you're still trying to lose the weight, and if you eat more than 1,000, you might get a lot of stalls and plateaus.
That makes a lot more sense. One question that I'm personally curious about, I don't know if other people are curious too, but bariatric surgery. Now, I did a deep dive on an episode like about a month ago, and I
Mhm.
didn't know that they've been doing bariatric surgeries like back in the 60s and 70s. Like not to the level that we're doing them now. Um,
Right.
and so it's a very, very common surgery now, even compared to 8 years ago when I had it. And I'm just personally curious, have they done any studies for like long-term effects, or if there's any like long-term complications or things to keep an eye out for it for people who are more than, say, 8 to 10 years post-op?
Um, well, I mean, different surgeries. Gastric bypass is the longest operation that we've been doing
Mm,
since 1967, as I explained. And we know with gastric bypass, there are some complications that can happen in the future, especially if patients don't take their vitamins. Vitamin intake is very, very important with gastric bypass, because if they don't, there is a good chance they're going to go into vitamin deficiency, and it depends,
okay.
what vitamin they're deficient in, B1 or B6 or B12. So with sleeve, I haven't seen any vitamin deficiency. I recommend them to take their vitamins
Mhm.
and every day, but I haven't really seen any vitamin deficiency with sleeve. Again, with gastric bypass, I have seen like iron deficiency. I've
Mhm.
seen osteoporosis, but with sleeve, I have not.
Okay.
And that's why sleeve is like the gold standard now. I mean, like 90% of all the operations I do right now in sleeve, and patients have very good weight loss with very low complication rates.
That's good. Okay. You gave me hope. That's good news. Um, One thing that I tell people I don't have any regrets about my surgery. I would not change a thing, because I feel like it defines who I am now. It made me the person that I am. Had anything been different, then my life might have gone differently. However, the one thing that I despise the most post-op is my personal loose skin issues, like in the arms and the stomach and the legs. And like I feel like we can't really get away with it. You've stretched your body and you've put damage on it for so many years, it's bound to happen. But I feel like I tell myself, had I just worked out earlier in the journey, then maybe my loose skin wouldn't have been as bad. Is there anything that really can be done to limit the loose skin, or is it pretty much just a given?
It really depends who we're talking about, like what age group. For example, like a 60-year-old woman is going to sag more than a 30-year-old woman
Right.
if they lose the same amount of weight, because 30-year-old has more retraction. It can retract back. But what I really highly recommend is that once you start losing weight, you got to hit the gym.
Yeah, you
And
gotta hit the gym.
I want my patients to hit the gym, 6 to 7 days a week, and I want that to be part of their life. And I highly recommend them to do a different exercise on a daily basis, because first, they don't get bored.
Yeah.
And second, you basically exercise all the muscles in the body versus only a group of muscles. Okay. And that way, your metabolic rate goes up, you burn food more efficiently, and your skin sagging becomes less. But if we have a patient that does sag, we do have a plastic surgeon on the team, and what they do, a lot of liposuctions, a lot of, we do tummy tucks. These are the three most common procedures for
Hmm.
patients who want to get plastic surgery after weight loss surgery: is a tummy tuck, breast lift,
Hmm.
and
Hmm.
brachioplasty. Brachioplasty is right
Yeah,
here.
the arm. Well, I have a hoodie on now. You can't see it, but I tell my biceps go in the opposite direction too, and it's probably like the thing that I am so like self conscious. So wait, so you do that kind of surgery at your facility too?
Yes, yes, we do.
Hmm.
Yes, we do. Yeah, most of our patients after 9 months, they see the plastic surgeon, and he basically takes over all the cosmetic, procedures that patient is interested or patient needs.
Okay, so you may or may not get a website inquiry from a 41-year-old um, looking for a consultation. Um, just keep an eye out for it. Somebody asked a really great question. When are people generally cleared to be able to start exercising post-op?
um, 4 weeks.
Oh,
Usually
that's not bad.
the first 4 weeks, I just want them to do daily activities and walk. as much as they can.
Okay.
Okay. And after 4 weeks, they can do whatever they want. They can go mountain climbing, hiking, biking,
Yeah.
go to the gym, anything they can do because they're pretty much healed up at that time.
Okay, that's good to know. Yeah, I really wish I would have. I walked religiously in the very beginning for like the first year, year and a half. I did not. I was always afraid of the gym. I thought by if I went to the gym, I was going to become bulky and a bodybuilder, and I didn't realize that no, it's just building muscle and toning everything. Um, so Firefly's Journey had a question: will insurance cover the plastic surgery?
In some situations, they do. I give you an example. For example, let's say you want a tummy tuck, and
Mm-hmm.
the panis is that skin, the overlying skin
Yeah,
that is hanging. If the panis comes below the pubic bone, or if there's a rash underneath the panis, then it becomes a medical necessity, and we write a letter of intent to the insurance company that hey, we have to take this out, and we have to do a tummy
yeah,
tuck because it's a medical necessity, and then they approve it. Okay,
yeah.
but for any other procedures like brachioplasty or breast lift or augmentation, they usually don't.
But is there a way to tell insurance that, hey, my boobs are deflated very, very badly and it's bad for my, self esteem post op? Like, and I can tell you, insurance is tough. With me personally, I try to apply to get insurance, to get approved for this tummy tuck and the brachioplasty, the arms, and I was denied, which deflated my ego and my soul as much as it deflated my boobs. But for some people, yeah, insurance can cover. It depends on your insurance company. Mine didn't.
It can cover breast if, for example, again, if there's a rash under it, or if it's too big and it's heavy and you're getting
Mm-hmm.
back pain from it, it does cover it in that aspect.
Yeah. Nydia, okay. To answer Nydia's question, I did appeal it, and I just found out 2 days ago that they still denied it because they said that my skin did not hang down low enough to be considered a medical necessity, which is why Dr. Paya might be getting a website inquiry in the
Yes,
next week
yes.
or something like that.
We might
Ooh,
be able to get that approved.
and maybe we can do a live stream, and you can like do the surgery on a live stream and like show everybody like
We can do that too, for sure.
would be
That's a good idea.
amazing. Um, oh, I already asked that question. I know one of the biggest concerns that people have that make them very hesitant to have the surgery in general is you always hear one or two of like the really bad horror stories, the complications that can happen. From my deep dive that I did, I heard that the complication rate is such a low percentage, but I'm just curious if there's any factors that come into play that can cause someone to have complications, or is there anything that we can do beforehand to prevent as much possibility of that?
Let me reassure everybody, complication rate with bariatric surgery now is extremely low.
Mm.
Okay, it's like getting your appendix out, or getting your gallbladder out, which is a very common general surgery procedure. It's that low. Um, for example, like anything else, if you start with a high risk, for example, if the patient is older, has had heart attacks in the past, has COPD, their chance of getting complication is higher than somebody who is 35, 40-year old with
Right.
no problems. It goes like that. But overall, if you take an average person, morbidly obese, who gets the procedure, complications rates are extremely low.
Oh, which is good to, and I'm hoping that people who are watching that right now, that's very comforting that it is such a low number, especially now. And then I'm curious, why is it so common that people end up having their gallbladder removed after having bariatric surgery? And that doesn't happen to everybody, but I feel like it's a very common thing. Have
Um,
you?
well, you cut out, Sherry, a little bit. Are you talking about gallstones?
Yeah, I'm just curious why gallbladder surgeries are very common post bariatric surgery. I'm like, is there a correlation to that?
Yeah, there is actually. gallstones happen due to the rapidity of the weight loss. For
Okay.
example, we used to see gallstones a lot with gastric bypass because the weight loss is pretty fast. Okay, with sleeve, we don't see gallstones, and like with gastric balloon, we don't see gallstones at all. Um, but with gastric bypass, we used to see about 25% of the patients who got gastric bypass did get gallstones. And if that happens, and if they're symptomatic from it, that means
Mm.
they have right upper quadrant abdominal pain, usually after eating. Um, that is a sign of gallstones. And what we do, we laparoscopically go in and take the gallbladder out, including the stones, and their symptoms resolves.
Wait, I have to ask a question. So, ever since I've had surgery, usually one of my tall tale signs that I've either eaten a little too fast or eaten too much is I tell people I get like this pressure pain, like right below the breastbone, above the stomach.
Right in the
Where you
middle.
say,
Uh-huh.
yeah, like it's kind of like you can't see. It's like right here, like right
Uh-huh.
below the
Right.
breast. It's almost like this pressure, and then sometimes, like if I go for a walk, it'll help it, or if I, pop a tums, like that'll help too. Is that more of a gallstone thing, or is that just more
Um,
like a gas?
it doesn't sound like gallstones,
Okay, thank
but
God.
if you're concerned about it, you can also get an ultrasound of the abdomen that shows if you have gallstones or not. Yeah.
Yeah, which is true. And I know for me personally, when they did the ultrasound as part of the pre-op process, I think I had gallstones, but they said they were so small it wasn't like a concern at the
Right.
time. And that's one of the questions that I meant to ask at the top of the show is I've heard that one of the reasons that people will choose bypass over sleeve is because sleeve patients are more common to get heartburn or acid reflux. Oh, he just decided to disappear. It must have been something I said. Looks like his connection went out, but Firefly, I'm going to get his question answered because I personally have heard that people who get the sleeve tend to have more issues with heartburn and acid reflux. And I'm one of those people. For I mean, to this day, I still live off of Tums. I've noticed that there's certain foods that I eat that will exacerbate it more, like tomatoes, onions, garlic. I'm Italian. I'm not giving up garlic, so I will just make sure I have Tums when I eat it. But I have heard that there are people who have had the sleeve and then the acid reflux or the GERD will get increased, which is why sometimes they'll resort to having the revision to the bypass. Um, but then first, and like also to those of you who are watching right now, I'm hoping Dr. Paya is able to jump right back on now. I mean, we only have a few minutes left in the show, but I would like to be able to say thank you like when he comes back. But to those of you guys who are watching, like I'm so grateful that you guys were watching today and you asked a lot of really amazing questions. I've talked to Dr. Paya, before, and he did say he was open to coming back again. So I'm hoping that we can get him back. And if there's any questions that you feel that weren't answered today, or if you have more questions, you can always reach out to me at sherryarcuria.com, which you can see here like on the little screen. You can send me a message. If you guys are watching this on YouTube right now, if you put it in the comments like you guys have been, I'll be able to oh, they're coming back on. It's fine. It's live. This is what happens. And I joke around. I'm a shit show all the time. So sometimes, just like everything else, the rug can get pulled underneath us and you kind of get a little blindsided, but the show must go on and you keep going. So like I said, if you have additional questions that we don't get to in today's episode, you can write them in the comments here because once this episode airs, it'll stay on YouTube. So you can always watch back later. If you are new to the show, you can also listen to past episodes either on Facebook or YouTube at Unzipped with Sherry. You can also find us on Spotify and Apple, also at Unzipped with Sherry. Try to make it easy. And if you guys are watching and you would like to be a guest on the show as well, I would love to have you as a guest. Just make sure you reach out to me. We can schedule a time to chat and hear about your story. And if you're new to the show, you haven't been watching, the whole purpose that I wanted to create this is I think that there's a lot of questions and a lot of things that we go through in this surgery that weren't very much talked about very often or you're not fully prepared for. And I think too often we will see before and after pictures on social media, and you see somebody's after picture and you're like, oh my God, I want this. I'm signing up for this surgery. And I think a lot of times we're not fully prepared with everything that happens between that before and after picture. So that was one of the concepts of the show that we wanted to do. And I believe he is back. Welcome back. I think the audio might be off. Yeah, we don't hear anything. We'll give him a minute to see if he can get his audio working. So Nydia says that you have your surgery tomorrow with Dr. Paya. That's so exciting. I would love to hear back from you
Okay,
once you're
very
more
good.
healed.
Sorry
Well,
about that. Yeah,
was it
Nidia
something that I
is.
said? I was just joking.
We had a Wi-Fi issue, but we're back and we're good.
Oh, so Cindy says, thank you, Dr. Paya. I have to get going, but wanted to make sure that you know that I appreciate you taking time out of your busy day to come and chat with us.
Oh, absolutely. This was good for me, and I like for my people to see all the information that's out there, and glad to be back anytime soon.
I would love if you would be willing to come back again. I'm hoping that we didn't scare you off too much today. And I know that we only have like a minute left, but I wanted to know
Not at all.
if there's any final advice that you can give to people who are like watching this right now who have not had the surgery yet, or either on the fence or they're getting prepared. Is there any advice that you can give them to ensure, to give them like something to look forward to, or give them hope that there's light at the end of the tunnel?
Oh yeah. Well, I can. I want to reassure everybody that weight loss surgery nowadays is extremely safe and very effective. I would say most of my patients are very happy they got it. They always come back to me and say, "Doc, I wish I would have done this earlier." But again, it's never too late to get it done and enjoy your life to the fullest.
I absolutely love it. And people who are in your area who would like to see if you're covered under their insurance, is there a website for them to go to check out your page?
Oh, absolutely. Yeah. Surgythin.com. We have all the insurance listed there, or they can call our office at 818-888-7090 and talk to one of the girls here, and they can tell them if we approve their insurance. But we approve most PPO insurances and Medicare, and you can check with us to see if you're going to be a candidate, or your insurance is going to be covered.
Okay. And so I have one last question for you before you go. Just because your case is so unique that you've kind of taken like over social media, and you're like, how do I get out and like, give people information on a daily basis? And you have a very busy schedule. You are literally changing people's lives on a daily basis. First, how do you find time to make some TikTok videos? And two, what made you decide to even go down that avenue?
Well, I've always loved social media, and now social media has become one of the most informative medias out there for, to get the word out, and to, I do a lot of question and answers on the social media. People have a lot of questions. I try to answer it for them.
Mm-hmm.
And whatever time I have, which is away from the practice, I get on social media and talk to the people.
That's so awesome. So if somebody wants to find you on TikTok that is not following you already, what is your TikTok handle?
Dr. Paya. And Surgythin, SURGITHIN.
Okay, perfect. Well, first and foremost, thank you so much for being here today. I personally feel 1,000 times better that some of my questions that I've been asked, wondering for a long time myself, that you were able to answer. And two, I think this is going to help a lot of people who are either on the fence, or people who are even like years out that find themselves kind of floundering a little bit, maybe having some regain, or kind of like needing some hope to get back on the track. I think there was so much really valuable information that you provided today, and I truly can't thank you enough for all of it.
Yeah, I sincerely had a great time. But thank you, Sherry, for definitely having me on your show, and I appreciate it.
And I didn't scare you away. You're going to come back, right?
Of course, of course. No, no, I had a really good time.
Okay, sounds good. For
Okay.
those of you watching at home, thank you guys so much for tuning in. Like I said earlier, you can watch episodes on YouTube, Facebook, Twitter at Unzipped with Sherry. You can also listen on Spotify, Apple, Twitch. I think there's like a bunch of things out there. Also at Unzipped with Sherry. If you would like to be a guest on the show, or if you want to ask Dr. Paya questions for the next time he comes on, just give me a shout out. You can send me an email to info@sherryarcuria.com, or you can comment on any of these videos and I will make sure to find you. And on that note, thank you guys so much for tuning in, and we will see you next week.
Thank you, Sherry.